We want to alert you on an emerging health risk that's coming about for women right now. Last month, the FDA asked the maker of a textured breast implant to pull them off the market after more evidence that they are linked to cancer. Here's NBC's investigative and consumer correspondent Vicki Nguyen with what patients need to know.
Tonight, cancer survivor Raylene Halra is celebrating.
I'm still almost speechless. It's absolutely going to save lives.
She's had cancer twice. After a mastectomy for breast cancer, she got textured implants. 5 years later, those implants caused BIA-ALCL, a cancer of the immune system.
I don't want anybody else to go through what I've been through.
The FDA revealed there are now 573 cases of this cancer worldwide, including 33 deaths. Most involve textured implants made by Allergan, which issued a voluntary recall and said in a statement it's taking this action as a precaution after seeing the latest research. Patients and doctors have raised concerns for years.
They actually can come, point,
forming networks on social media to warn women.
The textured surface is almost like a tiny Velcro. It grows into the woman's body. I believe that that's the source of the breast implant-associated lymphoma because there's an interaction between the woman's body and the implant.
Last November, NBC News, in conjunction with the International Consortium of Investigative Journalists, found the disease could be more common than previously thought, with rates as high as 1 in 1,000 in women with implants.
We still have a lot of work to do because there's thousands of women still with the implant, so we need to make sure they're informed.
Raylene is now cancer-free. Doctors say if the cancer is caught early, it can be treated successfully.
And joining us to discuss this further is Dr. Jeffrey Antimarino. He is a board-certified plastic surgeon and an advisory panel member for Allergan. Welcome, sir. How are you?
Good morning. It's good to be back.
Well, you were on the panel that's advising them. What do you think of this FDA recall of the product?
Well, I think it's a good thing. And we've known about it now for an Allergan and actually Mentor and Sientra are the other two companies. And it's been ongoing studies now for over a year. And we talked about it the last time I was on your show a few months ago, and you know, it's the first thing I want to make sure everybody knows it's not the silicone, because that's what everybody thinks about right away. It's a silicone has been a problem. The silicone isn't a problem. It's the actual. This is one of their implants. It's the texturing technique, and some of the implants, not all implants. This one's a smooth implant. This implant is not an issue. Every implant when it's made comes out smooth shelled. Then there are certain ones, depending upon the demand, that they will texturize. Now I
can feel the texture of this one.
And the reason
this one's very smooth.
Right, and you can see this is anatomical. This is the gummy bear implant that everybody was talking about. But the reason they texturize it is because, as the film said, it's more like a Velcro, so that those implants don't spin in the pocket and turn upside down. Mm-hmm. So
it seems to be shaped like a normal breast would.
Right. So mostly for breast cancer reconstruction, these were nice implants. I stopped using these about 15 or 16 years ago, any kind of shaped implant, and I've always, from that time on, I've always used smooth, even in my reconstruction, because I think it works better. I didn't like the fact that the implant can spin, and the reason these can spin is because of the way it's built. It's a little bit heavy on the bottom. But it's the texturing technique, that the chemicals that are used, the texturing technique that causes the cancer, the lymphoma, not the implant itself. Now, the other two companies have the same issue, just not as the same problem as Allergan. Allergan's texturing is a little more aggressive than the other two companies.
And to stop the spinning?
To stop the spinning. And so it does. It actually works like Velcro. It's very effective. And again, you know, it was an idea back in the day to solve a problem of spinning. And now they found that and again, it's a small link. You're looking at 573 cases worldwide, and you're talking about, in this country, 320,000 women a year get breast augmentation, 125,000 get reconstruction with implants, just in the United States. And textured implants, for those of us who do a lot of breast augmentation, there's not a lot. There's only about 10% of the world's market is textured, used in the U.S. 90% of textured implants used for augmentation are done in Europe.
So if a woman has had the textured breast implant, what's the likelihood that she may need some other further reconstructive surgery to remove that and replace it with something else?
Well, the biggest thing that women have to remember is that, again, it's a very small incidence, but it's real. And as what we talked about last time, it's a real incidence that we need to make sure women understand that it's there. What you're looking for, the most common symptom or sign that you have an issue is that it's a quick onset that one breast gets swollen. Just out of the blue.
That's the first warning sign?
It's the first warning sign. The average has been about 8 to 12 years. So it can happen at any time, but the average time frame is about 8 to 12 years. So as I've always talked about, any woman with a breast implant, whether it's silicone, saline, smooth, textured, any change in your breast, you should be seeing your plastic surgeon or a board certified plastic surgeon. Any changes where it's a change in shape, it's not as soft as it used to be, the size is different, and that may not be, that's usually not associated with this lymphoma, but it's a change in the implant, it could be a change in your breast, and you should just have it looked at. But for those women that are getting this sort of this acute onset of this swelling, the first thing that the surgeon should do is have some of that fluid aspirated and look for it. There's certain biochemical markers that are associated with that lymphoma. Is
that the best detection system?
It is.
X-rays reveal it, or what?
No, X-rays won't reveal it. Ultrasound will reveal the fluid. Mm-hmm. But remember, it's not a breast cancer. It's a lymphoma, so sort of like a non-Hodgkin's lymphoma, and so it's the capsule that forms around the implant. So
that's one of the more treatable kinds of cancer,
right.
isn't it?
So any medical device that's implanted, whether it's a breast implant, a hip, a knee, plates and screws for fractures, pain stimulators, your body will actually form a little thin layer of scar tissue around that implant. That's where the cancer in this breast implant, that's where the cancer is. It's in the capsule, that scar tissue. So if a woman sees this and is seen early, the treatment is going into surgery, going through that small incision, actually taking out the capsule, take out the implant. That's curative, and you can put in another implant at that time if you'd so desire.
You had mentioned silicone being a problem or a worry before, but is that a thing of the past nowadays?
I think it's
leaks
something that
in the breast implant?
These implants now are 5 layers thick. There's very little leaking, very little rupture rate for any of them, and not only just Allergan, but also for Sientra and Mentor. They're all good companies. So I think we've proved that silicone is safe. There's silicone in everything that we use. All the rubber and everything that you touch has some silicone in it. Not everything.
But it's not implanted in your body, though.
No, but things that you come in contact with. Mm-hmm. I mean, women are worried about silicone, but the pacifiers, the nipples on the bottles, they're all silicone based, and so you're worried about your child. But again, it's not implanted. But silicone over the years has never been shown to have any problem. There is what we've talked about, the breast implant associated illness, and so some women are electing to take their implants out, which is fine. In this case, the FDA is not recommending those women that are not having issues with textured implants to have them removed. But if the woman, for peace of mind, or is just worried about it, then she should talk to her plastic surgeon about.
But the important thing is recognizing some sort of warning sign.
Absolutely, and those are the warning signs. They're pretty obvious.
Okay, yeah. We're going to take a break. Dr. Antimarino will stick around to talk about other subjects, including what happens if your child wants to have some sort of plastic surgery. Well, if you're a parent, you'll want to stay tuned. Dr. Jeffrey Antimarino is our guest. He's a board-certified plastic surgeon. A lot of times, children want some sort of plastic surgery. It may be because they're being teased because of their ears. I told you in the commercial break, my father used to tell me that kids called him Bat because his ears were so big. What do you think when children want plastic surgery? What drives that? Is it the teasing, the bullying?
Some of that is, and when it's early on, but then there's a lot of things on social media now that we didn't have to deal with when we were kids. But when we talk about, ear surgery, we do that as plastic surgery. We try to do that at 5, 6 years of age before the kids go off to kindergarten, where they're going to get teased a lot. But usually by the time the kid is 5 and 6 years old, the ear is pretty much formed to almost the adult size. So there's not much change in the ear after that. So it's safe to do. It's a quick, easy procedure. There's not a lot of healing time. So that is something I would do.
What do you do to an ear?
Well, a lot of times that the ear, the upper part of the ear, the inside, this part of the ear, where the cartilage is, sometimes for some people, it's not formed where we all have that sort of that crease in the ear. It's not formed, and so the ear sticks out. So you can make an incision behind the ear and actually go in and form that crease for them, and it just tips the ear back. So nobody even knows they had the surgery because the incisions are behind the ear, not even seen.
What about other forms of cosmetic surgery for children?
Yeah, I don't believe in a lot of cosmetic surgery until the child is really 18 or older. I've done breast reductions on ladies that are as young as 16.
Breast reductions?
Yeah, and there's some of these 16-year-old girls.
It's a health issue, though.
It is. They're having issues with neck problem, back pain, shoulder pain. They're not able to participate in sports, plus the psychological effect. Being a teenager with F and G cup breasts is terrible. I like to wait, and most of us like to wait until the breasts are completely stable and they're not getting any larger in size. Otherwise, you run the risk of reducing a breast and then it continues to grow and you have to do it again. So it's something you have to warn them about. Also, it could interfere with breastfeeding in the future, and so you're talking to a 16-year-old girl about that. But there are some patients in my practice who can tell you, I've asked them at 16, their breasts were too large for their frame, but not overly excessively large, and the breasts were still growing, and I put them off another year or another 2 years until it stabilizes. That way you really only have to do one reduction. There are some ladies that come in and they have one breast that's large and one that barely formed. So that's more of a reconstructive thing. And when the breasts are stopped developing, 16, 15, 16, 17 years old, I think it's okay to do a reconstructive. But when you're talking about, most of the stuff we're talking about is noses, especially for boys, your face is still changing. 16, 17, 18 years old. There's no reason to go in and change a nose, and then this bony structure changes, and now the nose is shaped wrong again. Same thing with girls. I usually wait until they're 18 years old at a minimum before I do contemplate cosmetic surgery. And again, at that point, I have to talk to the patient, and I have to know that they're initiating it and for what reasons they're initiating it. And we have to do the right thing by the patient, and I think that's the main thrust of this. As a plastic surgeon, you have to do what's right by the patient.
In the time we have left, let's talk about spa treatments. This is no longer the domain of women,
right.
But many men are going in for
Sure.
this. Is this okay as a plastic surgeon, in your opinion?
Yeah, absolutely. I think that we're seeing a big change in what men feel because, a lot of guys are working longer. Guys are taking better care of themselves. And so what men are finding is that they're more fit, but as they're in their late 40s, 50s, 55, they're more fit, but that doesn't change the aging process. You can be as fit as you
get a little jowly.
You get a little jowls, you get some wrinkles, you get a bit of lines. So we see a lot of guys coming in for Botox. That's probably the number one. Dermal fillers are next. And so guys, in fact, my practice for facelifts and eyelid surgery for men has gone up tremendously over the past 5 to 8 years.
Is that a poison? Some articles I read say it is.
Yeah, basically you have to, in large doses, it's a poison. But this is such a minuscule amount. And what it does is you're giving such a small amount. What happens is every muscle has a receptor that when your brain says flex your arm, the nerve endings release a messenger that binds to the muscle. And then that contracts the muscle. Botox looks like that messenger called acetylcholine. It has a very similar three-dimensional structure. So when you inject the Botox now goes and it binds to the receptor, but it doesn't allow the muscle to contract.
We only have 30 seconds. Do you have any faith in all these expensive creams that are advertised on TV? I see them all the time.
No, I don't have a lot of faith in that. I think there's very good moisturizers, hydrators, you can have a temporary plumping from those, but they're not going to be any long term. They're not going to erase scars.
So plump now.
Yeah. You look rejuvenated. But they're not going to change things permanently or long term.
Dr. Antimarino, thank you for your expertise. We appreciate these health warnings for women who have had reconstructive breast surgery, okay?
All right, thank you so much.
Thank you. All right, I'm Chris Moore. Our program will continue in just a moment. I hope you'll stay tuned.